As kids aged 5 to 11 head back to class, experts say they're seeing a vaccination gap.
Uptake among this age group has been worse than other age groups.
But that depends on where you live. Across Canada, 46% of 5 to 11-year-olds have now received at least one dose of a COVID vaccine. In Newfoundland, uptake is 70%. Less than half of younger kids in Ontario are vaccinated, and in Alberta, it's even less.
I'm definitely not ready to say that we're going to only stay at this less than 50% uptake. I think it's going to go up.
Concerns over vaccine safety are lowering. Nearly 9 million doses have gone into the arms of young kids in North America alone. Doctors have seen few side effects and many benefits.
The vaccine effectively prevented the development of mult-system inflammatory syndrome, which is a post-infectious problem that can be serious, and especially in children aged 5 to 11.
Doctors insist children are still less likely to get sick, but Omicron is leading to more infections.
We're now learning so much more about severity in children and how kids get hospitalized.
Studies suggest instead of the lungs, the Omicron variant attacks our airways, causing upper respiratory illnesses, which tend to be harder on children than adults. Recent data from New York State shows among children newly admitted to hospital, 91% of 5 to 11-year-olds were unvaccinated. Only 4% were fully vaccinated.
I just had to feel confident.
Julie Rizvani recently had her 8 and 10-year-old vaccinated.
As children return to school, I am feeling I made the right decision. I'm actually waiting for my children to go get their second vaccine.
Despite the Omicron surge, many doctors say waiting 8 weeks for that second dose does boost protection, adding patience is also key when it comes to talking to parents about the value of first doses for their kids. Christine Birak, CBC News, Toronto.
Okay, now I have a few questions for the president of the Canadian Medical Association, also a pediatrician, Dr. Catherine Smart, joining us from Whitehorse. And Dr. Smart, you know, we heard in Christine's piece about a potential COVID complication called MIS-C. Can you expand on that? What is it, and how does the COVID vaccine help prevent it?
So MIS-C is an inflammatory condition that happens in children who have had COVID, usually not while they're infected with COVID, but afterwards. And what we know is it's not related to the severity of illness, but it is a very serious complication of COVID. And it happens in about 1 in 3,500 children who have had COVID. And it's more common in children that are 5 to 11 years old. So one of the good news stories, I think, in recent days is that the vaccine for children is looking like it is very protective against MIS-C. It's about 91% effective in preventing that complication from COVID. So I think it's just one more reason for parents to choose vaccination for their kids in that 5 to 11 age group.
And yet, you know, one thing we've noticed is that we are seeing dramatically more unvaccinated kids in hospital than vaccinated kids in hospital. What is the most serious consequence of that?
Well, I think it's what we know. You know, COVID, the syndrome of COVID is a vaccine preventable illness, and that holds true in children as well. Your best protection against having bad outcomes or having to have your child hospitalized with COVID is having them vaccinated. And that's why I think that message is so important. You know, we're seeing right now in Canada, less than 50% of children 5 to 11 have been vaccinated. We know parents are worried about the return to school, and we know what we want to really be doing is using all the tools in our toolbox to keep children as safe as possible, and vaccination is one of those critical tools.
And can I ask you, I mean, you know, when we talk about the strain on healthcare and hospital resources, which is arguably one of the most critical problems these days, particularly in the age of Omicron, you know, it's usually in the context of grown-ups, right? Of adults who are under or unvaccinated. But are we seeing this similar strain for children's healthcare because of their low vaccination rate?
Well, I think what we're seeing right now is because the cases of COVID are rising so exponentially from the Omicron variant, we of course are seeing more children who have been infected. That denominator is growing. Of course, many of them remain unvaccinated. So we have seen a rise in hospitalizations, but it's definitely not in the same magnitude as what we're seeing in adults. COVID is still primarily a mild illness in children. That is not to underplay the fact it can be a severe illness and that is the outcome for some children and that can be prevented through vaccination. So we definitely are seeing that uptick in hospitalization right now because those case counts are rising. And again, I think the real message to parents is let's do all the things that we can to keep our kids safe, and being vaccinated is definitely the right move in terms of preventing that outcome.
Okay, Dr. Smart, a pediatrician and president of the Canadian Medical Association, joining us from Whitehorse. Thank you so much.
Thank you.